I had a patient send me an old photograph and about what maybe his goals were with a surgery, and I don't like old photographs. Old photographs have so many problems with them. They're unrealistic, they're not appropriate, and they should never be even there, except for maybe a few small exceptions, which I'll talk about. So here's the issue. You show me a prepubescent hairline, which most people don't show me a prepubescent hairline, but they may show me a prepubescent hairline, which is maybe a 12 or 14-year-old. That hairline for a male before puberty strikes is rounded. It's a transgender or female hairline. It is not natural. A rounded hairline, which you're seeing on Instagram nowadays, is absolutely a violation of all natural rules. And it saddens me to see that doctors are performing these procedures because they have absolutely no understanding of what makes a natural hairline. I am constantly lecturing about these issues so that people understand what are problems. And that is seriously problematic. Or they go wider than the canthal zone and make this hairline that looks weird just to compensate if they don't have enough grafts. It looks bizarre. In fact, I had a patient that I did a neck lift on. He didn't have FUE with me. I saw in the office, I couldn't tell him he had it done elsewhere. His hairline doesn't look natural. It doesn't look right. It's off. But he can't see it. I'm sure he's incredibly happy with it. But they violated all the rules. So when I'm looking at the rules, I'm constantly following those rules. So why is an old photograph problematic? The reason is that people don't think about the temporal border. They're thinking about the hairline. So if that hairline, they think, I just want a really low hairline. They don't understand that the low hairline they once had was also matched with a temporal point that goes out to here. All they see that their hairline was lower. They don't see that this is receded back to here. They don't care if they have a hairline down to here, but I do, because if you have a hairline down to here and the temporal point is back here, it looks like a bad hairpiece. So it looks weird. And so when I try to show a patient, I actually want to teach my students this. The lateral canthus is a point that I want you to understand the importance of. If this is not clear, I'm going to teach you some rules of hairline design. I'm not going to go through all of them because there's so many rules. But the lateral canthus is the joining of the upper and lower eyelid from the outer portion. And when you take that point that goes up, everything to the side of it is temporal hair or lateral hump. So when you see someone taking temporal hair or lateral hump and they move it to the middle, why does that look weird? That's called a comb over. Why does that look weird? Because hair that's lateral to the canthus should not be moved to the middle of the hair, okay? And so when this area recedes and this area recedes, they have to be built to some level of balance. When you just move your hairline down and your temporal position sits way back here, the result is weird. It was interesting. I've told this story before in a video. It's worth repeating, and then I'm going to tell you why it's important. I was on a cruise with my parents and my wife about maybe 3 years ago, maybe 2-3 years ago in Italy, and I saw a guy who was worth quite a bit of money, so he could afford whatever he wanted. He had a hairpiece I could see that was off-centered. I saw the actual release. I could see actually the fibers that were not maintained well. I could actually see the weave where the hairpiece was coming off the head. I could see his temporal hair transplant was off-angled. There were too large or 3 hair grafts in the hairline. They're sticking farther out. I could see the horrible linear scars that were done on the backside. And I didn't embarrass him with any of these questions or try to sell him a transplant. But I asked my parents. My mom developed my building here. She's a very smart woman, incredibly bright one. My stepfather is a physician, very smart guy. My wife is an astrophysicist and a theoretical mathematician, optical physicist. She majored in these things at Emory because she said it was the easiest one. She didn't have to actually study and open a book and blew out every curve. So these are not stupid people. They're very smart people, but they could not see anything I pointed out to them. And the reason they couldn't see it is not because they're not smart, because they don't do this for a living. In fact, I was watching a James Bond movie with one of my business partners who's a hair surgeon up in the East Coast, and I said, guess what is going on right here? And he says, I don't know. I said, his hair is not right. What is it? He said, I don't know. I said, he has a hairpiece on. He can't tell it's a hairpiece. He's doing hair for 10 years. I can see it, and the reason I can see it is that I just have trained my eye to see when things are wrong. When I was teaching a student in my course that was about 5 years in practice, she couldn't get the canthal point right. She was off by 3 millimeters. And you said, well, hey, Dr. Lamb, 3 millimeters, come on. No, 3 millimeters is the difference between a natural result and a fake result. And she couldn't see it. And she says, Dr. Lamb, I'm so nervous doing this course with you because I've been making this mistake for 5 years. I said, I'm sorry that happened, but now you get it. I'm being really critical with you so you can see that point. So I know I'm going on a digression that sounds like it has nothing to do with, old photographs, but it really has a lot to do with it, because if you don't understand the rules, you'll show me an old photograph, you'll show me, hey, I want my hairline here, and it doesn't match everything because the temporal point position is so critical for everything to be in harmony. Or, another patient of mine said, hey, I want a lot of hair in the front, I don't care what sits back there. That's called a front heavy result. That looks like a toupee. You do not want a bunch of hair sitting in the front. It looks bizarre, and you cannot have that. It violates all the rules. So these are some points that I think are not articulated well, and that's why you got to trust a doctor with an aesthetic eye and a ton of experience. I've written 9 textbooks on hair transplant, and so you really understand the rules. I've innovated the rules. I've actually innovated ways to teach these rules to people to help the beginner student and intermediate student understand hairline design. So old photographs are not helpful. I have to look at your age, I got to look at your donor density, I got to look at your facial shape. And now I try to actually create a hairline that's subtly different maybe than what you ever had to give you the best aesthetic frame. And you say, well, wait a second. I mean, I hear all this stuff in facelift surgeries where people look weird and changed, and are you going to make a hairline that looks weird? No, it's a creative decision. So what I do is, like, if someone has a very wide face and I create this little narrow area, that's aesthetically poor, even if they've always had it. Now, I don't force someone to have one that they think they don't like, but I don't offer them a fake result. So you've got sort of 2 criteria going on. You got natural and you've got aesthetically pleasing. So I don't want to violate any natural rules. And by looking at those old photographs, again, you don't understand the position of both, and that is what causes problems. But the second thing is that I also want to explain to you about how can I design a hairline that looks good for you, that would be appropriate for you. So for example, if you've got a very narrow face, I don't want to make a wide hairline because it won't look right for you. But to be honest with you, if I make that hairline too narrow, I over-exaggerate the narrowness of your face, it doesn't look good. Now, let's say I draw that for you and you say, no, I don't like that, Dr. Lamb. I want my face to look narrow. Okay, well, if I don't, it doesn't violate natural rules, and I can't convince you that what I'm designing looks better, no problem. But I'm not going to change. If you said, well, if I radically change my hairline in a way that I've never had, it's not necessarily a bad thing. I don't think anyone will be detected. I've taken people with a bald head and put hair on their head, and people don't even know. So I don't think it's going to create a fake result for you that would make you look weird. It's just an aesthetic design, sort of like a rhinoplasty. If you've got a big hump, if you want the hump down, I'll take it down. But if I take it down too much, the tip will look too large and won't look balanced. That's not good. You want everything to be in harmony. So when I'm dealing with a hairline, I offer suggestions that can enhance your look, but that are natural and that are safe. And I don't mean safe just now, but what I'm thinking about 10 to 20 years from now. I had a gentleman that was 27 years old that says, look, I don't care what I look like at 40, just make my hairline super low. And that is deadly, because what I think about when I create a hairline and when I do a design is not just what the problem you have today, but what could show up in 10 years. And that's it. And I have to care for you. I always joke with my patients, but it's true, is the definition of old is someone 10 years older than you now. So I'm 55 years old right now. At one point I thought 55 was pretty old. That was probably 20 years ago. Now I think 75 is pretty old. But my parents are 85, and if you tell them they're old, they're going to tell you, no, I'm super young. I think 95 is old. So, at one point, I remember at 25, I thought 35 was super old. At one point at 15, I thought 35 was super old. Now I think 35 is super young. It's just a relative idea. So what I've got to do is protect you from your future self, because right now you don't think you're going to care when you're blank age. It happens all the time. I have a 60-year-old coming in. Well, I just want to look good now. I don't care when I'm 70. I got a 7-year-old coming in. I don't care what I look like. And when I'm 80, that's super old. I don't care. Just make me look good now. At 20, I don't care. Just put a crazy transplant. I think it's going to look amazing for me as long as it's natural and beautiful and it fits my face. I don't care what I look like at 30. Well, it could be a disaster at 30 that I can't fix. So that's what I mean by safety. So we have to look at aesthetic design. We have to look at one that's natural. So those are different. Aesthetic and natural are different. Of course, if something's unnatural, I don't think it can be aesthetic, but I think it can be natural and still unaesthetic in the way that I described facial shape, gender, ethnicity, etc. So you want to be natural and you want it to be aesthetic, but safe. That means over time, I have an escape valve to fix it if there's a problem in the future. This last one, people do not think about. They don't care about. I have to care for you because I guarantee that you may be one of those people that you say the words in 10 or 20 years, I don't care what I look like, and I do have to care. My design will actually include a safety valve. Now, when I talk about safety, I don't have there's no crystal ball. The future is not 100% clear. That's why you have to be more conservative and careful. And these aggressive hairlines, these aggressive weird hairlines that violate all the rules of safety, natural, and all that are problematic. And that's why looking at those old photographs are not good. Now, I told you at the very beginning of this video that there are some exceptions. So what are these exceptions? So one is the old hairline. You may have had a little widow's peak, a little design that you liked, that you always had, that you lost with hair loss. Okay, let's put a little widow's peak, okay? If it's safe to do a temporal point, you had a strong point, and there's enough grafts for me to do that, okay, and you like the way that was, I could do that. If you said, I always had a rounder hairline, now it's become V-shaped, and you want a little bit rounder, and that's what you used to have, okay, maybe an old photograph could be helpful, but it will not look like your old photograph. So these are the small tidbits of things that may be okay, but they certainly not at the level that you have in your mind perhaps, and that's why I want to keep you out of risk and danger. So hopefully this video, understanding why I think old photographs are problematic, will help you, guide you in your search for the right transplant surgeon, and also what is an appropriate hairline for you.